there, I'm Dr. Heather Christie, and I'm a family medicine physician who also has additional training in functional and aesthetic medicine. And one of the top questions I'm asked is, what is functional medicine? Functional medicine is a form of integrative medicine, and instead of looking at a disease process of this is disease X and we treat it with ABC treatments, we look at more of the whole picture of the person. One of the things we're doing in functional medicine is looking at the human body's metabolic, hormonal, and biochemical pathways at the cellular level, and then treating patients' various disease processes or symptoms at that level. This, of course, isn't all there is to functional medicine, but it is an approach that's different to what I did as a family medicine. And again, the biggest difference for me as far as how I approach patients is I'm not looking at just a disease process. I'm really looking at the metabolic pathways in the body, among other things, hormonal pathways as well as pathways that are involved with energy and metabolism. In medical school, we all had to learn these various pathways, and what was touched on, but what we really didn't delve into, at least when I was in school, is that nutrients run these pathways. And in a bit, I'm going to pull up an interactive website to show you what I'm talking about and how important nutrients are at the cellular level of our bodies. One thing I'd like to say that functional medicine is not, this is not a substitute for traditional medicine. This is not a substitute for your primary care doctor or any other specialist. Just like in medicine where we have PCPs and specialists and whatnot, we are not interchangeable. We all have our roles. And functional medicine is really to be used, in my opinion, as an adjunct to regular American healthcare. I don't think this is the end-all be-all. This is one of the pieces of the puzzle. And frankly, doing this for a while now, I've been doing functional medicine for a couple of years, but doing this, it's been the missing piece of the puzzle in getting patients better. Especially with stomach issues and whatnot, but a lot of other issues where with regular medicine I was throwing pills at people, which is fine. I know pills serve their purpose, but I didn't like just having those in my toolkit. I like having other supplements and other ways, modalities of treating patients in my toolkit. And most people that are seeing me nowadays are on the same boat and thinking the same way I am. As far as a functional medicine patient, like who is the most ideal patient? Basically, if you've been seeing doctors galore and not getting better, and I hear you because I've seen that so many times, and everyone's doing the best they can, but sometimes we just don't have answers or can't fix things, then I would say consider a functional medicine approach. Again, not as a substitute, but in addition to what you're doing with your primary care doctor and your other specialist physicians, because my experience has been the functional medicine is the missing piece, at least from my career, and how I'm getting my patients feeling better and getting better, which we're all happy about. So if you're just not getting better with regular American medicine, consider seeing a functional medicine doctor in your area. Or if you just want a different approach to health and not just taking pills all the time, and again, I'm not anti-pill, but your functional medicine doctor will have other tools in their kit to help you get healthier and feel better. And ideally, get rid of some of these disease processes too. Functional medicine can help the body become as healthy as possible. We've treated a lot of different symptoms and various issues that with traditional medicine, we're really just giving people pills to take care of, and that's not getting to the root cause of what's happening in the human body. So as I was saying, with the metabolic and hormonal pathways, I'm going to pull up this active website that I found online. There are various ones out there. And I went with this one, or I chose this one. This one is from Roche, R-O-C-H-E. Hopefully I'm pronouncing that correctly. You can just Google search interactive metabolic pathways, and again, you can find different sites that do this. One thing I like to do when I'm with my patients is I type in, let me get this right. I can type in a vitamin, and this interactive map will show you, here you go, 999 places in this metabolic map where our bodies need vitamin D. I mean, look at that. I'm a visual person, so yeah, this gives a great visual. I mean, it's just an oh my goodness sort of reaction when I pull this up in front of patients. In some places, the body uses vitamin D as a substrate, which means one of the ingredients in the chemical reactions. It might help with the enzymes that are doing the different reaction. It might be a coenzyme, or it's helping support the enzymes, or actually be a role in that. So, I mean, this is just one nutrient. For example, I'm just going to put in vitamin B. And of course, we have more than one vitamin B. And everyone I've been testing, by the way, is low in something with the Bs. So B complex with folks is not a bad idea. And look at this, 530 places. in this map where one of the B vitamins is needed just for our bodies to run. I get various tests with my functional medicine patients, and all of us are going to be deficient in something, some kind of nutrient. Look at CoQ10. And we go through the lab results, and the results are about 12 pages long. I mean, it's a pretty in-depth analysis. And we're looking at different parts in this pathway too, which I'll get on in a bit. But yeah, CoQ10, 323 places in the body where it's needed, and is also key with energy and our body's ability to make energy at the cellular level. So let me take this out. And so here you can see there are different, this map is divided up, and there are different processes, but it's all interconnected. I mean, it is all interconnected. And that's how I describe functional medicine, is it addresses the interconnectedness of our bodies, which in regular medicine, we're diagnosing a disease. This is disease X. We treat it with, A, B, and C treatments, versus looking at how everything is interconnected. You can poke around on this if you want and just geek out like I have. There are other ones online that look less hideous and a little bit friendlier if you wanted to check those out too. Again, I just like this one because I'm familiar with the schematic, and yeah, it's just a great interactive map. So you can see on that schematic how everything is interconnected and the importance of nutrients in our bodies. And some of the testing I do is doing nutrient assessment, and not just checking for nutrients, but also checking those products that are in those various pathways. Because, for example, if there's a product that's high, then what's happening is somewhere in the pathway, that product is not being allowed to move forward to other steps in the pathway. And usually it's because of some sort of nutrient deficiency. Looking for nutrient deficiencies because things get hung up and don't flow correctly in the pathways like they should, because they're not working correctly because of lack of nutrients. So that's one thing I'm looking at. Also with these tests, we touch on mitochondrial health. Mitochondria is the powerhouse of the cell. It's the organelles that makes energy at the cellular level. And these test results touch on that. They also touch on liver detox. You may or may not know the liver does a lot of detoxification in our bodies. And of course, everyone is a bit on overload with the amount of toxins and whatnot that we're exposed to. So I hope you enjoyed the video. Take care and have a good afternoon. All right, bye-bye.